Okay. So when it comes to cervical radiculopathy or cervicalgia, which is neck pain, or numbness and tingling to the arm, hand, fingers, it can become from two different things. Let's talk about disc herniations versus disc bulges, right?
Okay.
Two different symptoms. And you're gonna have some really cool information right now. So when we talk about disc herniation, now this is the lumbar spine in this model here, but it's still the same thing.
Right.
When we come here, this is a disc bulge, and a herniation would be stepping on the jelly donut where the water's coming out.
Yep, I gotcha. That's the nerve, right?
Yes, this is the nerve.
That's right. Yeah.
When it comes to disc herniations, the major difference is what the contents of the inside water really is doing. Is it the inside water still contained within the balloon, or is it extruding onto the nerve?
Herniation would be extruding.
Yeah, so
bulge would
like
be
this little
contained.
material comes out.
Oh, I see.
Kind of falls out.
So it's still contained, but
so imagine if I pop this.
Yeah, right.
This is a bulge still. If I pop this,
It's a herniation.
it's a herniation. It starts to leak out.
Right.
That's like stepping on the jelly donut and the jelly coming out the back, and then the ants coming to eat it.
Yep.
That's the inflammation.
Got it.
So what's the major difference aside from like that? This, right? The major difference in terms of healing. Let's talk about healing first.
Yeah.
Bulges, by definition, are not creating as much inflammation as they are, as you think they do.
Okay.
Because a bulge does this, right? That means the contents of the water is still within the balloon, or the contents of the disc are still within the disc.
Got it.
That means the jelly is still in the donut.
Got it.
Okay?
Got
There's
it.
no ants coming out and eating the inside of the jelly.
Got it.
So if you step on this, the herniation now comes out, the ants start coming out. That tells me that exhibits a crap ton more of inflammation.
Got it.
So because you initiate a larger cascade of inflammatory cells, you then start to increase your pain and inflammation. Interesting enough, the people who have more disc herniations actually have a higher rate of healing that injury.
Oh, wow.
Why? Inflammation. Because that sets off the cascade, says, hey, we have some sort of inflammation, let's eat away those inflammation, let's eat away, let's start to restructure it. Whereas the disc doesn't set it off to the near cascade, to the let's just say it's 2 levels down or whatever. It's like, okay, well, it hurts, but it's not creating inflammation.
Right.
Do I know what you really have without getting an MRI? No.
Right.
Unless you have serious symptoms where you're like, maybe you're leaking a little bit of the fluid out and it's like a small little subtle point. To be honest, I don't know.
Yeah. Okay.
I'm not going to know without an MRI. I don't have MRI vision. I'm not Clark Kent on steroids.
Right.
I'm not going to know. But I can tell you you're having some sort of impingement from the nerve, whether it's from direct compression, whether it's from inflammation. And you can have a disc bulge that's not even hitting this nerve. It's just causing a ton of inflammation from all the exercise, from whatever you're doing, maybe from just doing bad workouts.
Right.
Who knows?
Yeah.
But I can tell you right off the bat, that is the differences. Okay. So where the heck? What I try to do when it comes to this nerves is I'm going to pull out the nerves here. We have this whole network of plexes, and this network, when you have inflammation, the way the body really is you have one spinal nerve root, right? Comes right out of the nerve hole right here, and when you have that nerve hole that comes out, what happens is it branches to different areas. It becomes the trunks, then it becomes the divisions, then it cords, then it becomes the actual nerves themselves. But they have this overlapping system, just like the I-5 right here branches off into the 52 and branches off. They all have their own little networks, and it's almost like an overlapping system. So when you really inflame one, or one, let's just say one nerve right here, you see it, this is the ulnar nerve, but it consists of C8 and T1 at this level.
Got it.
When you have, I'm just going to say this one right here, the lateral pectoral nerve, it consists of C5 through C7. So you can have more than one area, and if you really irritated one level here, how do I know that it doesn't create enough inflammation that it affects the mechanics not only above but below? And now we have let's just say we have a moderate inflammation here and a mild inflammation here and mild inflammation. And now you're having multiple symptoms. You're like, what the heck is really happening?
And you don't really know which one it's coming from too, because the
Exactly.
symptoms are saying it might be coming from C5 through C7.
And here's what I said before we even got onto this diagram. You can have a C7 disc herniation with C6 symptoms on an opposite side.
Yeah, I get it.
So
I get it.
I'm just trying to correlate, do you have this neck pain with what is happening?
Right.
Is it consistent, and can I actually treat it properly?
Right. Well, would an MRI help at all? Wouldn't it though, to know if it's a bulge or a... Because is the treatment different?
No.
For bulge or herniation? Okay.
No.
Yeah.
No, because your clinical signs and symptoms are the same, and your relief symptoms that you've told me that you do at home are within the treatment paradigm of how I'm going to actually treat this disc.
Okay.
Because on average, 99% of the disc or 95% of the disc, they herniate posteriorly and laterally, meaning back and to the side.
Okay.
So if they do that, all we have to do is somehow open up this nerve hole. Most of the time, because they're compressed going forward with their neck going forward, which is why flexion hurts your neck, usually extension makes it feel better.
Yeah.
Because extension
it doesn't though for me right now. Like
right now, that's because you're not in the right position, and I'm going to show you certain exercises that actually do that.
Nice.
Do that.
Nice.
I will tell you, and I already know you're going to be diligent on your exercises. When I had my disc herniation that night, I did 400 to 700 repetitions that night. I did about 1,000 the following day, and then 400 the next day. And I'll tell you the same thing as I tell every single patient. When you do these exercises, you're going to do them every freaking day, X amount of times that I prescribe them. You can do more if you want, but definitely don't do less. And if you do less, don't even come in.
Okay. Fair
Because
enough.
I'm going to tell you, go ahead and do them again.
Right.
And you're going to be like, what? You're going to pay me to tell you the same thing? Go ahead. Yep, that's what you're going to do.
Yeah,
So don't waste
fair
your
enough.
time.
Right.
Because I also want to have data to know if you're actually getting better.
That's right.
If we're not getting better, then at least I have data to say you're not getting better despite you doing the work.
Yep.
Then I could change up my protocol.
Totally understand it. Yeah, get it.
Just like anything else. So when I was kind of going through and I was kind of tensioning the nerve, what I wanted to do is pull down on the ulnar nerve. Surprisingly, the ulnar nerve is the one that runs right here, and it goes down into these lateral fingers here.
Mm-hmm.
That didn't create symptoms. That's
It's
this
just
movement.
not. Yeah. Yeah, I got to tell you, really, except for that one day, it's all just been to here. And numbness and tingling don't happen. It's just that shooting pain. I've never had tingling at all, and I've never had numbness at all. It's just been this horrendous pain that goes right.
I
to
never
here.
had numbness or tingling either.
Okay. Just want to let you know. Yeah.
No,
yeah.
I had more fatigue within my musculature.
Oh wow.
Like achy fatigue, and I had more like that sharp
Yeah, I
like,
got that one.
pulling, like almost somebody's like pulling something out from the inside out.
Yeah.
I think that's what we're doing in that case. When I did this and I locked the elbow out, I also did something you probably didn't notice. I dropped the shoulder this way. What that does, and if you remember, I was pulling on your shoulder going down.
Uh-huh.
When you pull on the shoulder going down, what you do is you take the cords up here and you just pull them down a little bit. So you just do this. So if you probably noticed, when you first got injured, your body was naturally like this on one side.
Yeah.
That's a natural mechanism to heighten the shoulder, contract it, and put these cords that are irritated in a slack position. That is the same thing as doing this.
Uh-huh. I get that. Yeah.
So when you see like...
It's like limping. Like you're just favoring it by like...
Yeah, so when you see
staying off
somebody doing that, they're going, I can see my shoulders off. I'm like, don't
It's
worry
not
about your
your
shoulders.
shoulders.
It's your nerves that are pissed off and your body's compensating because it doesn't want to hurt it any further.
that, yeah.
So now that you're at a pain level where it's not at 8 or a 9 or a 10,
Yeah.
maybe even less than a 7,
Yeah.
your body starts to say, okay, I'm not in the threatened position. I can at least lower this a little bit. Now, if I go ahead and do an exercise which is like a bench press, or I do a tug on one side, you're really just kind of pulling down on the nerve a little bit one side. Maybe you're doing a bench press or something like that. Think about it like this. Your body just got injured, okay? When you take that jelly donut and you add extra pressure,
Right.
like,
Yeah.
and you exert
Yeah.
that, you're literally bearing down naturally, and so the disc gets squeezed a little bit.
And guess what? It's right above my cervical area.
And
It's right above. It's like, boom, all that pressure on the bench is behind you. and the
Exactly.
neck's
So you're
smashing
getting
it
a lot
back.
of that compression, and that's what we call bearing down. We
Yeah.
call that a Valsalva. That's actually an orthopedic test. If you cough or sneeze, or go and blow on your own thumb, that's called a Valsalva maneuver. That usually increases patients' pain when they have disc compression.
Yeah.
So guess what we're not going to do? That type of stuff.
Yep.
So if you need to go exercise and do a bench press with 5-pound weights, go for it. I'm just saying.
Right. Yeah.
Because you're not increasing the pressure enough to like create problem, but yet you're staying physically active. Right. The one complication that we have as an athlete yourself is how do we maintain somebody who wants to stay active, needs to stay active, desires to stay active, but yet treats an injury and not make them worse.
Right.
It's called proper programming.
Right.
And
well, the other thing with me is luckily the way I injured it isn't what I do. Like, I don't give a crap about lift. I mean, I lifted for my whole life, but I got to a point where I'm like, actually, I would just rather lean out and be light than be puffy, and I'm done with that. So.
Well, you can do both a little bit, but
absolutely, yeah.
And that's really it. And I truly believe in lifting to some extent.
Yeah.
Again, everybody's different, but I think in your case, what we need to do is just do our best to decompress the disc, take pressure off.
Yeah.
Probably gonna have to work some of those tight muscles and areas that are kind of bounding up around there. One, that will help you just with pain relief. Two, that will help you with your mobility and healing a little bit faster. And I do a lot of ART, if you've ever heard of it, or active release technique.
Yes. Yeah,
so I'm going to pretty much pin down one of the muscles, and we're gonna let the nerve slide by it.
Oh, cool.
So it's pretty much like going like this. You ever stop at a stoplight and the truck goes forward and it makes it feels like you're going backwards?
Oh yeah.
So relative to that truck, did you stay the same, or did you actually go backwards? Well, relative to the truck, you actually went backwards because the truck went forward.
Right.
So that's kind of what like ART is like doing. We pin down the muscle, which is that car that you are, and we let the muscle or the truck go forward, and that creates the slide that we need without irritating the nerves.
Very nice. Yeah.
So that's kind of what we'll do.
Cool. Yeah.
And then I'm gonna give you a crap ton of exercises.
Nice.
And when I say a crap ton, I mean 1 or 2. Why I'm only gonna give you 1 or 2? Get you out of pain, 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 get you out of pain. That's all I care about right now. No offense. That's all I care about.
No, it's great. That's all I care about right now, too.
If you start trying to strengthen and do these chin retractions, which are great, by the way, for the next level, but you start doing them and you start taking this irritated disc and you start shearing it, which is really what you're doing, you're not going to be able to do this. You're going to keep irritating that nerve.
Yeah.
So let's not irritate that nerve.
I tried doing them, and I was like, this is just hurts. Like, I figured if it's hurting it, maybe I'm making it worse.
That's good. Well said.
Yeah.
If you're hurting it more, you're making it worse, and you're not, and you're